Nanotechnology applications in fertility treatments, utilizing nanotechnology for targeted drug delivery and diagnostics. Nanotechnology is playing a transformative role in reproductive medicine, offering new ways to enhance fertility treatments, improve drug delivery systems, and revolutionize diagnostic techniques. By utilizing nanoscale materials ranging from 1 to 100 nanometers, nanotechnology can create more precise, efficient, and personalized solutions for fertility treatments and diagnostics. One of the most promising applications is in the area of targeted drug delivery and diagnostics, where nanoparticles can be used to directly target reproductive tissues and deliver medications with minimal side effects, as well as enhance the accuracy and speed of diagnostic processes. 1. Introduction to nanotechnology in fertility treatments. What is nanotechnology? Nanotechnology involves manipulating matter at the nanoscale, typically between 1 and 100 nanometers. At this size, materials can exhibit unique physical, chemical, and biological properties, making them ideal for a variety of applications in medicine, especially in drug delivery and diagnostics. B. Nanotechnology in fertility medicine. In the context of fertility treatments, nanotechnology is used to improve the efficacy of hormonal therapy, sperm enhancement, embryo development, and drug delivery. Nanoparticles can be engineered to target specific tissues, allowing for more precise delivery of treatments to the reproductive organs. Second, targeted drug delivery in fertility treatments. What is targeted drug delivery? Targeted drug delivery involves using nanoparticles to directly deliver drugs to specific tissues or cells in the body. In fertility treatments, this means delivering medications such as gonadotropins, hormones, or fertility drugs directly to ovaries or testicles, enhancing the efficiency and effectiveness of treatment. Benefits of targeted drug delivery using nanotechnology. Reduced side effects. Traditional drug delivery systems often result in systemic distribution of drugs affecting other parts of the body. Nanoparticles ensure that drugs are delivered specifically to the target tissue, reducing unwanted side effects. Increased drug efficiency. Nanoparticles increase the bioavailability of fertility drugs, ensuring that a higher proportion of the drug reaches the target tissue, leading to better outcomes with lower doses. Controlled release. Nanoparticles can be designed to release drugs in a controlled manner, ensuring that fertility medications are available over a prolonged period. This sustained release can improve the overall efficiency of treatments like ovulation induction. Conference applications of targeted drug delivery in fertility. Ovulation induction. Nanoparticles can be used to deliver gonadotropins directly to the ovaries, reducing the need for high doses and minimizing side effects, like ovarian hyperstimulation syndrome, OHSS. Endometrial preparation. For embryo implantation in IVF, nanoparticles can deliver hormones to the endometrial lining, improving endometrial receptivity without affecting other organs. Male infertility treatment. Nanoparticles can improve sperm motility and protect sperm DNA during the fertilization process, making IVF and other ART treatments more effective for men with low sperm quality. 3. Nanotechnology in diagnostics for fertility. Nanodiagnostics. What are they? Nanodiagnostics involves using nanoscale materials, e.g. nanoparticles, quantum dots, for highly sensitive diagnostic and monitoring applications in fertility. These nanoparticles can be engineered to bind with specific biomarkers related to fertility, such as hormones, proteins, or genetic material, allowing for early detection and monitoring of reproductive issues. Benefits and advantages of nanotechnology in diagnostics. Increased sensitivity. Nanoparticles can bind to fertility biomarkers at very low concentrations, making it possible to detect fertility issues much earlier than traditional diagnostic methods. Non-invasive testing. Nanotechnology enables non-invasive methods for monitoring hormone levels, ovarian reserve, sperm quality, and other fertility factors without the need for invasive procedures like biopsy or surgical sampling. Real-time monitoring. Nanotechnology can enable real-time monitoring of fertility markers, allowing clinicians to track ovulation, embryo development, and sperm quality continuously, leading to more personalized treatment plans. Applications of nanotechnology in fertility diagnostics. Early detection of fertility issues. Nanosensors can be used to detect low levels of reproductive hormones like FSH, LH, or AMH, which are important markers for ovarian reserve and overall fertility. Male infertility testing. Nanotechnology can provide faster and more accurate tests for sperm DNA integrity, motility, and morphology, which are critical factors in male fertility assessments. Embryo monitoring. Quantum dots and nanoparticles can be used to monitor embryo development during IVF, providing detailed insights into the health and viability of embryos through nanoimaging and biomarker tracking. Fourth, future prospects of nanotechnology in fertility treatments. Personalized fertility treatments. As nanotechnology advances, personalized fertility treatments will become more common. By using nano-enabled drug delivery systems, fertility medications can be tailored to each patient's genetic profile and specific reproductive needs, leading to higher success rates. Regenerative medicine for reproductive organs. Nanotechnology may play a role in the regeneration of damaged reproductive tissues, such as the ovaries, testicles, and uterus, through the use of nanoscaffolds that can support the growth of functional egg or sperm-producing tissues. Bioengineering of artificial gametes. The combination of nanotechnology and stem cell research may enable the development of artificial sperm and eggs, which can be used in infertility treatments for individuals who cannot produce viable gametes due to genetic conditions, cancer treatments, or other causes. 5. Challenges and ethical considerations. Ethical concerns. Gene editing. The ability to use nanotechnology for genetic manipulation of gametes or embryos raises ethical concerns about creating designer babies or making changes that could be passed on to future generations. Embryo selection. The use of nanotechnology for selecting embryos based on genetic or physical traits may lead to eugenics concerns and social inequality. Safety and regulation. Nanotoxicity. The long-term safety of nanomaterials in human applications is still not fully understood. Nanoparticles could pose toxic risks if they accumulate in tissues or organs over time. Regulation. As nanotechnology advances, there will be a need for rigorous regulatory frameworks to ensure the safety and ethical use of nanomaterials in reproductive medicine. Sixth conclusion, nanotechnology is revolutionizing fertility treatments by offering more targeted, efficient, and personalized approaches to drug delivery, diagnostics, and regenerative medicine. While the future prospects are promising, it is essential to address ethical concerns, ensure safety, and create clear regulatory guidelines to harness the full potential of nanotechnology in reproductive medicine.